Good morning, everyone. Today I'm joined by Tony Kinslow, who recently joined our community as our new Vice President and Chief Human Resources Officer. Tony, welcome. It's so wonderful to have this time with you. It's been just a few weeks, and we're so glad that you could be here with us today and we could have this time together. For those who may not have had a chance yet to get to know you or get to meet you, could you give us a little bit of a sense of your background and the journey that led you to Georgetown?
Sure. And first, though, I really want to thank you, President DeGioia, for inviting me to do this so early in my tenure. It's just an honor to be able to join you in this conversation. But my background includes 25 years of human resource experience in higher education and healthcare at schools like Vanderbilt, Caltech, most recently the University of Rochester, and also I had stints with the Sisters of Mercy Health System and also with Cleveland Clinic Abu Dhabi. So um, I think that that background was was a big part of my journey because I could easily see Georgetown as an exciting and challenging capstone to my career in human resources because I came to Georgetown at a time when I was gained the understanding of the kinds of things that they wanted to do to develop the HR function. So I'm really excited to be here at at this point in my journey. And I could also say that, I fell in love with the District of Columbia years ago as an interning here as a law student, as well as the fact that I just believe this it is a vibrant, active, beautiful city, and just fell in love with Georgetown in the 80s when John Thompson was roaming the sidelines and devouring opponents. So I just I'm gratified and honored to be here at this stage of my career where I believe I can make a difference.
Well, thank you. Thank you. I know the idea of service has been important in your many roles in higher education and in healthcare. And you have spoken to me about being a servant leader and how that concept shapes your approach to work. Can you expand upon this idea of the servant leader and the values that motivate you?
So yes, I'd like to do that for just a minute. The What I like most about being a servant leader is the social compact that says that both the employer and the employee will be better because of the leadership of the individual who helps to helps them to orchestrate the work and to get things done, and that each will improve in the process. Um, I think that it was John Quincy Adams that said, if you can dream more and learn more and do more and become more, then and you inspire people to do that, then you are a leader. So I look at it from that standpoint, and certainly I know that the values that come with that include listening and empathy and compassion and but also it comes with being able to take a look at at how things might be in the future and awareness, and also just really a clear understanding of what the objectives are and helping others to understand that as well, and making sure that you move things forward, but that the person who is doing it grows and learns at the same time. That's the thing I really enjoy about the concepts around servant leadership.
Oh, thank you. Thank you very much. Now, you've had more than 20 years of military service as a retired member of the United States Air Force Reserve. How has your military service shaped your approach to leadership?
Well, the when I was a young lieutenant, I got an assignment in a dangerous part of the world and was given responsibility for about 200 people north of Seoul, near the demilitarized zone in Korea. And our job, I was in the Air Force, but our job was to be prepared to assist the Army at what they call the forward edge of battle by calling in airstrikes and making sure that we lays targets. And so we were and so that was an awesome responsibility for someone who was still in their 20s. But I was very fortunate. I was blessed that I had two chief master sergeants who were working with me, and they taught me a lot early on in my career about leadership. They told me that, first of all, they said, you're in charge or you're responsible. And so we can't take that away from you. That's not our role. And that courage is respected, that you have to um, think about the troops. And in many cases, you think about them and put them before yourself, that you have to be keenly aware of the circumstances that you're in and bring a sense of urgency to that because lives could be at stake. So I learned early on that those kinds of things were that leadership was important, that it was something that people valued, that it was and that people looked up to leaders to get information and instruction and guidance. And I have taken that role seriously and tried to live up to what folks taught me early on.
Thank you. Thank you very much. Now, in recent months, we've been working here to build a new framework to support public health and our response to the pandemic, to keep our community and those communities around us healthy. Can you talk about how you see your role in this important work?
Yes, so I think that HR plays a huge role with regard to the fact that we provide benefits for people for both their physical and their mental health. We have counselors on standby. We try to make sure that people understand that the purpose of the benefits is partly income protection, and that's a part of our role, is to make sure that people realize that they can seek assistance and it won't send them into bankruptcy. So that's a part of what we try to do with regard to the health and safety of our folks. The other thing is to provide guidance and to be able to ground them to the fact that they are important. They're important to this institution. Their work is important, and because of that, we provide certain um, aspects of, well, it's not really aspect, but we provide them with the tools to continue to perform despite the difficulties that might be going on around us.
Thank you. Now, across our university, members of our community are engaged in thinking deeply about our efforts to strengthen diversity, equity, and inclusion as we work to respond to the challenge of racial justice. Could you offer us a sense of how you view this challenge and any insights that you might be able to share from your prior leadership across healthcare and higher education?
So I appreciate that question because um, certainly I have spent a career looking at those issues of diversity, equity, inclusion, and I have come to, and in my tenure, I have come to the conclusion that it's increasingly critical to the survival of an organization. And I just by example, I was looking at some of the things recently, the demographics of Georgetown University, and what was interesting to me is that as you look at the different generations, there are 5 generations in our workforce, and so the generation, the what they call the silent generation or the greatest generation were folks who were born in the late 1920s. So, but then we have the boomers. who were born in 46 and to 64. They're the group leaving the workplace the fastest. As you take a look at the boomers and you look at the number of people of color in an organization, you know, the percentages are in the 40s. But if you take a look at our largest group, which now are the millennials, and the group of people in that uh, cohort, it's just the opposite. They're the people of color are in the mid 50s. So it has been a change, and if we want to continue to see the folks who help us run the institution, whether it's a researcher, a professor, a doctor, a lawyer, an administrator, we have to figure out how to make sure that those folks are comfortable bringing their whole self into our environment. So it's about that inclusion piece becomes extraordinarily important when you take a look at some of those things. You know, we really need to, and that's why I consider Rosemary such a key partner of mine at the institution, is because I know just how important it is that people see us as a place that is open, that's inclusive, that allows them to do their very best for this institution.
Wow. Tony, it's an honor to welcome you into our community, and we look forward to all of the contributions that you are going to make in these years ahead. It's a privilege to be able to spend this time with you this morning. In closing, is there a message you'd like to leave with the members of our community?
Um, yes, there is. I would like to just say that the work that we do in um, learning, research, healing, and creation and development is extraordinarily meaningful work. I'm proud to be a part of it. I think that every individual in the institution should be proud to be a part of it as well. It doesn't matter what level you work at, you make a contribution to that mission, and that you really are the reason that we can keep doing this, and that it's been done now for more than 200 years. I think that um, it is a great opportunity to add and contribute to your community, to your society, to work in a place like Georgetown University. And I'm grateful to you and Jeff for giving me this opportunity.
Well, Tony, thank you. Thank you again for being with us today. And we look forward to all that you will contribute to this place through your leadership and your service. And I look forward to being with all of you again soon. So take care of yourselves and take care of everyone around you. For every Hoya, everywhere.